So the next mobility movement we've got is a 90-90. You're going to stay on the floor, and here we're really looking at limbering up, loosening up, and opening up the hips. Okay, you will get some hamstring and quad stretch in this as well. All right, and it might feel like you're cramping the first few times that you do this. All right, oftentimes you'll feel that you're going to start cramping here in this kind of this joint, this hip ball and socket joint. This insertion here starts to get really tight in kind of your glute med. Okay, so what I want to do, I quite like using a yoga mat for this, because for me, of average 5'9" height, this gives me a nice width, and it helps me keep my legs at 90 and 90. Okay, hence the name. So I'm going to sit in this 90-90 position now, so that I'll have a tendency to lean over. Okay, so that I don't do that, I want to take my hand and post my weight on my left hand with my fingers pointing behind me and my palm pointing forwards, and already I can feel that glute med there, and I can feel that Golgi tendon tightening up a little bit, and it starts to feel a little bit like a cramp. Okay, so I want to try and stand up, sit up straight, maybe get your arm out as well as if you're having a cab or something, and that should help you to stay level and almost perpendicular to the floor. And then I'm going to try and sit my chest over my front knee. Okay, when I get as low as I can, I'll start to feel a pull in that lead leg, in the quad and in the hamstring. I'm going to push this knee down through the floor, okay, as if I'm trying to get up. I don't want to get up, I want to just push that knee, drive it in through the floor, hold there, activate for about 5 seconds, and start to lift that rear foot up as well. Okay, and sit in that for about 5 seconds. Now, what I often find is after that first one, I get quite tight here. Okay, again, that's just your kind of tendon trying to grab onto and secure that joint. Give it a second, sit with it, and it'll loosen up, and now it's starting to feel really nice. And I'm going to go forwards again 3 to 5 times. Okay, I'm going to sit forwards, drive that front knee down, lift that rear foot up, try and get a little bit lower each time. Sit in that for 3 to 5 seconds, come back up, and I'm going to repeat that at least 3 up to 5 times. Okay, once I've done that, I'm then going to shift to the other side. But in order to do that, I want to do an active bear sit to open up these hips. Okay, so the goal is to keep the outside of this foot on the floor as long as possible and actively open up, maybe as if you're in childbirth, I don't know. Now my left knee is starting to lift, and I want to imagine that I've got a string pulling this knee over by this kind of extended kind of front knee. I'm not sure if that's clear, but I'm imagining there's a string on my right knee and it's pulling my left knee now. That string is tight. I want to keep that string nice and tight and pull. And that starts to get quite hard there now as I'm in kind of childbirthing position. And I'm going to sit through, and on this follow through, I'm not going to collapse. I'm going to maintain now. The string is tight on my left knee. I'm holding up my right knee now with that string, and I'm lowering the right knee with the left knee. Once I get to 12 o'clock with the left knee, now the left knee is pulling the strain of that imaginary string so that I lower my right knee down nice and gently, and I'm pretty much in that 90-90 position. I can just reset quickly, take my hand, fingers behind me, chest up, arm out. This is starting to feel tight already. And then I just repeat that process, driving the lead knee down, lifting up the rear foot for 3 to 5 seconds. I come up, sit up nice and slowly. That's the first one on this side, and as I said, I can start to feel quite a nice pinch here now. Sit with that, just let it relax and settle. You can massage that in there a little bit if you've got a ball, or just get your fist in there. It feels a little bit nicer there, encourages it to loosen up. And then I sit forwards, drive the right knee down, lift that left leg up, hold that for 3 to 5 seconds, and I'll repeat that 3 to 5 times, okay? Once you finish that, complete that bear sit the other way. So now my left knee is going to start to take the strain in that imaginary piece of string. If the further back I sit, the easier it is, okay? So don't be afraid to make it a little bit easier on yourself. And now I'm pulling that right knee over, and once I get to about 12 o'clock, I'm lowering the left knee down, nice and engaged, and I'm pretty much back in my 90-90 where I started, and that's it. That's your 90-90, okay?